Hi, Dr. Urban here, and I want to talk to you about one of my favorite subjects. That is, that your body may, in subtle ways, be telling you that you have a problem, and that by being made aware, you can address that problem when it may not be so common, it may not be street knowledge for everyone like diabetes or high blood pressure. So let's get started. What I want to talk to you today about is issues like tics, those little twitches, tics and twitches, restless leg syndrome, restless sleep, and magnesium. For we know that it has been estimated that up to 80% of American adults are deficient in magnesium. I personally have taken magnesium for 20 years for a major problem, that being hypertension, which is well controlled. And I continue to take it today, but I've expanded my understanding of magnesium because recently I noticed that I would get a tic in my eye. If you notice my right eye, it isn't always a visible squint, but the sensation that your eyelid is moving. Plus, I occasionally get a cramp below my knee, usually the instep of my right foot. And I've taken that to mean now recently that I have magnesium, low magnesium levels. Now, and I take magnesium for it. What do I take? I take good old magnesium oxide. It's relatively cheap. I take 1,000 milligrams a day, and if I get any of the tics or twitchings, or I'm going to take it uh, additionally during that day. Now, think about this. What about restless sleep? I am going to follow the recommendations and take magnesium between meals or after supper, a couple hours before I go to bed. See if my restless sleep, which is not common, but occasionally, or I can sleep deeper. Just something for you to keep in mind. So remember, magnesium is good for tics and twitches, restless leg syndrome. That's a syndrome, a painful syndrome, which I think is related, cramps, and restless sleep. So think about taking magnesium. Don't make any changes to your healthcare regimen without first consulting your healthcare provider. This is for informational purposes only. But maybe you want just a little deeper sleep and less restlessness. Give magnesium a try. There are different forms of magnesium, and yes, the more expensive ones may be more readily absorbed, but I tend to think about masses of people, and I believe they will be helped by magnesium. I take 2 of these every day, and additional 2 if I have any tics or twitches, cramps, or restlessness. So give it a try.